Good afternoon, and thank you for joining today's webinar. My name is Matthew Jane, and I'm the Learning and Engagement Manager for the State Historical Society of Iowa. The Iowa History 101 webinars, presented on the second and fourth Thursdays of each month, explore Iowa's history from pre-statehood to current day. You can learn more about this series and all of our programs on our website at history.iowa.gov. Please remember to sign up for each webinar you'd like to attend, and don't worry if you can't watch live, all presentations will be recorded. Now, a few housekeeping points before I introduce our speaker. Everyone came into this webinar on mute with cameras off. Closed captions are available by clicking the closed caption button on your screen. The webinar is being recorded and will be placed on the Iowa Culture page of YouTube in just a few days. I've disabled the chat function, but if you have any questions, please type them into the Q&A feature throughout the webinar. My colleague, Rachel Hansen, is watching that feature and will prepare a list of questions for the speaker at the end of the presentation. But please note we may not have time to get to all the questions asked. And now I'm pleased to introduce our presenter for today. Dr. Jean Logan is a nurse, a researcher, and an educator who, as an elected official, served 2 6-year terms on the Broadlawns Board of Trustees. During her tenure on the board, she was twice elected chairperson. Dr. Logan holds a PhD from Iowa State University and a master's in nursing degree from the University of Iowa. She taught nursing at Grandview University for 33 years and upon retirement received the distinction of Emeritus Faculty. While she was a faculty member at Grandview, she helped design the caring curriculum, which influenced the title of the book, Broadlawns: A Century of Caring. For 100 years, Broadlawns has persisted through the worst and best of times, tending to the people of Polk County, Iowa. She helped write her mission statement for Broadlawns, the mission statement for Broadlawns, and was passionate about carrying out that purpose during her time on the Board of Trustees. This book is a culmination of research to document the history and the stories that illuminate Broadlawns over the course of last century. Under the name Dr. Jean Wolfe, she has previously published a series of 6 novels loosely based on her family's history. This is her first book of nonfiction, and I'm happy to turn it over to Dr. Jean Logan to begin the webinar for today.
Thank you for having me here today. I'm excited to share what information I have about Broadlawns Medical Center. This first slide that I am putting up here is a picture of the cupola, which really represents what Broadlawns is all about. And you'll notice that at the top, there's a double cross at the top, and there's meaning to that. And the meaning is that double cross represents the Tuberculosis Association, which the first hospital that Broadlawns built was called the Tuberculosis Hospital. And that cupola is still there today. It's on the center of the main building at Broadlawns, and it is now obscured by construction in the front of it, but it is still there. This is a slide of the first tuberculosis hospital, and you'll notice the cupola there in the middle. And on either side of the main hospital there, there are 2 wings. And if you look at the top of the slide on the right, there's a railing, and then looks like sort of a dark area in the middle of the picture, and that's a porch. And when people were diagnosed with tuberculosis in 1924, there was really not a lot of treatment. So the main treatment was giving people fresh air and sunlight. And every day at maybe 10 o'clock in the morning, they might put you in a wheelchair and wheel you out onto one of those 2 porches. They're identical porches on both ends of the tuberculosis hospital there. They would wheel you out onto that patio, and that would be your treatment for the day. On the far left-hand side of the screen there, that is the first nurses' dormitory. And I believe it would hold just about 100 nursing students. And then they would traipse from that building into the hospital to help take care of the tuberculosis patients. This slide is, I included this slide because I thought it was pretty interesting. At the back of the tuberculosis hospital, they actually built a fairly large cafeteria for the time, and it looks like there's a working fireplace there. And they had a big day where they invited all of the hospital administrators from the area to come in and have a luncheon. You can see there's flowered curtains, there's, fancy tables, and here Broadlawns was the public hospital from the beginning, but they had a fancy cafeteria. So I thought that was interesting that that slide happened to be in the archives. All right, there's something called the pest house. Now, what is a pest house? This was very interesting to me. When I was elected to the Board of Trustees, I had no idea what this building was at the back of the Broadlawns. And it turns out that when you're first diagnosed with tuberculosis, you're contagious. And they couldn't put you in that main building that I showed you earlier. So they would put you out in the woods, clear out on the east end of the property. And they called this white structure there the pest house. And that would be where you'd stay until you were no longer contagious. And then they would bring in people to take care of you at the pest house. The medical personnel would come in and take care of you there. This picture, it shows the house on wheels, because after they came up with a cure for tuberculosis, then they literally decided, well, we can't let that structure go to waste, so we'll just move it from the woods and attach it to the back of the hospital. And that's exactly what they did, and it's still there today. So over its 100-year history, Broadlawns has been known as the safety net for Polk County. And throughout its tenure, it's cared for people with communicable diseases. And so the first part of this presentation, I'm going to talk about the several cycles of communicable diseases that have occurred over the years, starting in 1924, which is why they opened the tuberculosis hospital. Tuberculosis is a respiratory virus. It's spread by droplets in crowded conditions. And in the early 20th century, there was little treatment available. Thus, streptomycin was hailed as a miracle drug when it was discovered in 1943. It led to a cure, followed by the closure of the pest house in 1946. So basically, when Broadlawns opened in 1924 until 1926, it was almost exclusively a hospital for tuberculosis patients. In the early days, there was an administrator named Thomas Sharpnack, and fortunately for me and for everyone else, he was there a long time, and he kept a journal. And I thought it was interesting that he kept this journal. In the book, there are many, he has many different citations, but I included just two of them that I thought were interesting to the history of Broadlawns. In 1933, he's saying budget cuts, 120 patients where 80 should be. 'Tis true the nurses crawled under beds to get to the next patients. Headlines, deplorable conditions at Broadlawns. Well, and over the years that Broadlawns has existed, the Des Moines Register and the Des Moines Tribune had several headlines about deplorable conditions at Broadlawns. And I thought it was interesting that back in clear in the day of 1933, they were still talking about the fact that there's these deplorable conditions. 1935 headline, doctors ask for abolition of Broadlawns and to distribute the patients to private hospitals. Well, believe it or not, when I was on the board in the 2000s, 2006 through 2016, there was some talk about the fact that Broadlawns should close and distribute their patients to private hospitals. Even then, Shrapneck says, I don't want to recall that. I'd rather remember that Anna, our faithful cook, got up at 3 a.m. to make bread when the strike was on. So that's the first part of the book is his journal excerpts, and he was quite the character. That was for sure. So the second disease then, that communicable disease, was polio. And at the same time that tuberculosis was becoming treatable, polio raised its ugly head in the 1940s. And the condition is caused by a neurological virus that paralyzes the lungs and causes disfigurement and neurological symptoms. Seriously ill patients were then sent to Broadlawns and placed in, quote, iron lungs. So I had the good fortune of being able to interview a lot of people for the book, which gave me a lot of wonderful insights into what happened to Broadlawns over the years and how Broadlawns emerged as a leading institution. But one of the people that I interviewed, her name was Helen Moss Tufts, and she graduated from the School of Nursing in 1950. And so at the time I interviewed her, she was 95. She is still very active with Broadlawns, is a big supporter of Broadlawns, but she had lots of stories to tell about Broadlawns. And I'm going to share one of her stories here in a minute. So as you can see, this is just a picture of what an iron lung looked like, and that's a child that is in that particular iron lung. It must have been a horribly scary experience to be put in this. It looks like a space capsule. You can see on the left-hand part of the slide there, it looks like there are some metal structures there, and those are actually portals where all the patient care had to be given through the portals. The machine works to create negative pressure so that it expands the lungs, which are very weakened from the virus. So when I was interviewing Helen, I just thought this story was fascinating to me. And here's what she had to say. As a student nurse, I worked through the beginning of the polio epidemic, which at times was a nightmare. You could get a call at any time to report to the polio area because a patient had lost the ability to breathe on his own. We literally ran to get the big old drinker respirator and put the patient in a vacuum-sealed atmosphere so that the machine would breathe for the patient. The contraption, better known as the iron lung, would force negative pressure in and out of the lungs. All the patient care was then given by pushing your forearms through portals. A rubber sheath kept the portals closed, and you went off duty with raw forearms from squeezing through those ports all day long. And according to Helen, the student nurses were the ones that literally ran that care for the patients. And you would go into a fairly large room, and the patients would be in these iron lungs, and there might be 6 patients in a room, and they'd be in a circle, and the nurse was in the middle and would then spend her day going from iron lung to iron lung, giving care, supporting them emotionally, supporting them physically. And that must have been just a horrific experience for both the patient and the nurse. So then the third communicable disease was HIV/AIDS. And in the 80s, a strange phenomena occurred. Young men were getting sick and dying. It was discovered that a virus spread by the exchange of bodily fluids, and that was to blame. AIDS attacked the autoimmune system, causing cancer and other life-threatening diseases with a high death rate resulting. Initially, there was little medical treatment, and many had no health insurance, so they were taken to Broadlawns. So I would say that if you look at the different healthcare institutions in the city, the vast majority of HIV/AIDS patients did go to Broadlawns because of the insurance issue. They oftentimes, when they got sick, then they could no longer work, and when your health care is tied to your work environment, then they lost their insurance. So Broadlawns would take those patients. So another person that I interviewed, his name is Dr. Nick Galeotto, and he is the associate director of the Family Practice Residency Program. And he says he had the privilege of taking care of patients who suffered from HIV, providing palliative care since there were so few resources available to them. Excuse me. I remember taking care of one patient whose HIV was progressing, and it had become resistant to AZT, which was the only drug available at the time. I was able to get the patient started on one of the newer medications before it became widely available to the public. And I just wanted to say, you know, that's one of the things Broadlawns does very well is when they have very few resources and very few financial support, people are able to think out of the box and come up with different areas where they can help that maybe other people wouldn't think about. And I heard that time and time again as I interviewed people for this book. And then, of course, COVID-19, we're all familiar with COVID-19 because it's just in our most recent history. Again, it's a respiratory virus, mainly spread by droplets. And initially, there was no treatment available other than oxygenation, respiratory therapy, and placing intensive care patients on the ventilators to help them breathe. And there is a picture of that nasty virus. So I turned to one of the respiratory therapists. Her name's Tracy Lynch, and she worked at Broadlawns for close to 40 years. She started there, and when she came to Broadlawns, she came in during the AIDS epidemic, and she left there during the COVID epidemic. So she certainly saw a lot of suffering and a lot of bad times, but she stuck with it. And one of her stories was her talk. She was in charge of getting the ventilators when, as many of you might recall, I can remember reading in the paper, okay, how many people are on ventilators this day? And you could see, I believe the Des Moines Register would publish how many people were on ventilators, how many ventilators were available. And it got to be a pretty narrow margin in terms of the patients who needed ventilators and the ones that they were trying to prevent from going on ventilators. But Tracy was talking to me about the fact that we did wear our ventilators out during COVID, and the patients were on support for such long periods of time, the machines were actually dying, and you couldn't always rent them. And we found a company in Texas that had our make of the ventilators, and they sent us everything they had, thank goodness. So you can just imagine what they were probably just tearing their hair out, worried about, are we going to be, because the ventilators that Broadlawns had were older to begin with, and the fact that they might not even be able to get ventilators, I'm sure just caused all kinds of panic. But this company was able to send them all the ventilators that they had, so that was so fortunate. Okay, so turning from the fact that Broadlawns has always cared for people with communicable diseases, the next component I want to talk about is the Broadlawns School of Nursing. The School of Nursing existed when the tuberculosis hospital was built, and it had lots of young women that came through its doors. But one of the things that was quite unique, it was a hospital diploma program, which was common during that era. You went to school for about 3 years, and at the end you graduated with a diploma in nursing, and you became a registered nurse after you took your board exams. But the one thing that was unique is that Broadlawns had a distinction in the 40s. It had 3 separate and complete hospitals. It had Broadlawns General Hospital, it had Broadlawns Tuberculosis Hospital, and it had the Broadlawns Contagious Hospital, aka the Pest House. They were all operated together at the same site, and it provided a very unique opportunity for nursing students that was not found elsewhere. This is a postcard of the quote new Broadlawns General Hospital. It was built during World War II, and as the tuberculosis hospital was still caring for tuberculosis patients, there was a need for other types of people with different issues going on. They might need surgery, and they didn't have anywhere else to go. So Broadlawns decided to build a general hospital, which was then, as you see on the left-hand side of the hospital, it is attached to the tuberculosis hospital, which would be found on the left-hand side of the page. The picture of some student nurses, kind of interesting if you're in healthcare field, but if you're not, you probably don't know, but I can tell because I'm a nurse. The person on the far right is the instructor, because as you can see, she kind of has if you look carefully, she's got a pin that represents the School of Nursing where she graduated from, that's on her uniform. The 2 student nurses that have the pinafores on, pinafores were sort of the uniform that most schools of nursing had. I'm not sure why, but it's sort of like an apron that went over the uniform. The nurse that's in the middle has 1 stripe on her cap, and the nurse that's on the far right has 2 stripes on her cap. And what that means is that the nurse in the middle is only in her first year of the nursing program, and the nurse on the far left over there she is a senior. She is on her 3rd year. Excuse me, I'm going to run that by again. If you didn't have a stripe on your cap at all, and you had your little pinafore uniform on, you would be your first year. And then the nurse in the middle is her 2nd year, and the nurse on the far left is in her 3rd year. She's getting ready to graduate. At the time, in the 40s, they had their own baseball team. And one of the nurses that I interviewed played 3rd base. And she was telling me about the fact that at the time that Broadlawns had this baseball team, they only had 1 truck, and they had a truck driver named Otto. And Otto would say, they would call Otto and they say, Otto, we need to go to a baseball game. And so he'd get his pickup truck and he'd pick up the whole team, and they would sit on benches in the back of the truck and sing as they went through the streets of Des Moines to maybe play another nursing school team across the city. So they had a lot of good times on that baseball team. And because the men were all at war, the women took over. Here's a picture of some of the nursing graduates from the class of 1939. You can see they're standing in front of the tuberculosis hospital there, right in the front lawn. I should say, I don't think I've mentioned this before, but here's how Broadlawns got their name. A nurse, when they built the tuberculosis hospital, she took one look, drove up to the front of the hospital and say, wow, look at those vast lawns. I think we should call it Broadlawns. So that's how Broadlawns got its name, and it has stuck ever since. Unfortunately, the lawns are mostly gone now because of all the construction, but at the time it was like driving into a serene, beautiful front lawn, and the nurses would oftentimes sit on that front lawn to study together, and it was like their own little oasis. And of course, in the 40s, they had a charm course, and students were required to take it. I was floored when I saw this. I thought, that's interesting. So here's the course description. A charm course is now being given in which students are taught the tricks of makeup and hairdos and are given reductions and special exercises for weight control. Graceful carriage and proper posture are also stressed. And I thought, okay, that's when they were all women. So I guess, that was something that it was a required course at the time. But charm course aside, Broadlawns relied on their student nurses to care for its patients, and they had great responsibilities. When the programs closed its doors in the mid-1970s, over 1,000 nursing students had come through its doors and graduated. A little story about the fact that they closed in the mid-70s. An administrator came into the classroom and told the junior students that they were going to be closing, and if they wanted to graduate in the next year, they were going to have to find a way to keep the school open. And fortunately, one of the psychiatrists, Dr. Sidney, stepped forward and paid for their whole education so that they could graduate the next year. So there were always people looking out to see if there's some other way that we can keep the doors open at Broadlawns. One of the biggest areas that I think was helpful in turning Broadlawns around from being a hospital that was constantly in the red to become a center of care where Broadlawns was able to be robust and serve the community is its emphasis shifted to primary care, where in the past, before the early to mid 2000s, Broadlawns was mostly an episodic hospital. People got sick, they came to the emergency room, they were treated, and then they went home again. There was not a lot of emphasis on primary care at that time. So what is primary care? Primary care is the provision of integrated, accessible healthcare services by a team of healthcare workers who are accountable for addressing a large majority of personal healthcare needs, developing a sustained partnership with patients, and practicing in the context of family and community. And like I said before 2006, the focus was on emergency and episodic care. And with that emphasis came its decision to not just keep care at that site on Hickman. I was there as a board of trustees when we opened the first community clinic, which was added on East University in Des Moines, out by the fairgrounds. And that clinic allowed people that live in that area who happen to be Broadlawns patients not to have to travel to the center of the city, but they could just be in their neighborhoods. And that was the point. Many of Broadlawns patients do not have access to transportation. And if Broadlawns could figure out how to have some clinics that were around the city and were much more accessible to the population, then that was to their advantage. One of the things I discovered early on was that patients did rely on DART to bring patients into the hospitals. And one of the things that we figured out was that let's see if we can make sure patients get to their appointments on time. So let's accord our appointments to the bus schedule. So voila, if the bus comes in at 10 o'clock, then let's make all the appointments at 10:15 so that everyone can get to their appointments that need to get to their appointments, and the bus schedules kind of dictated the patient schedules. And so that was a real aha moment for me, just thinking about the fact that we rely on our cars so much and we don't. I was at the hospital one day when there was a torrential downpour of rain, And I looked around the hospital and I said, where is everyone? And somebody said, well, if you've got a newborn baby and you are supposed to be at the hospital for a well baby check, do you really want to take your baby out in a torrential rain and stand in the rain waiting for a bus to come by? Well, probably not. You're not going to do that with your baby, your newborn baby. So all kinds of issues that come up when people have transportation problems. Medical education. Medical education is a big part of Broadlawns, and it has deep roots in Broadlawns. In the late 60s, Broadlawns had one of the very first programs in the nation to establish a 3-year residency program, and it happened to be in family medicine. So family medicine hooks right into primary care. So those two programs together made a big impact on the motion of Broadlawns forward. And in the past 10 years, 60% of those graduates have gone on to practice either in rural Iowa or in public hospitals. Another really, really, really important part of Broadlawns is its emphasis on interpreters and or translators. Interpreters will take the language that patient speaks and interpret it so that it can be interpreted into English for us non-English or non-language speakers, multiple language speakers. And then translators will look at the written word and translate that way. The picture that you're looking at consists of our 7 full-time interpreters at Broadlawns. They're employed full-time. There are 3 full-time Spanish-speaking interpreters. Well, I'll tell you that in a minute. Here they are. 3 Spanish-speaking interpreters, a Bosnian, a Vietnamese, Pashto, and Burmese, and Karen. And so those are the languages. And let me tell you, those folks are very, very busy. But they are constantly being pulled to different areas of the medical center because if you enter the building and you are just looking around, you'll hear multiple languages going on at once, and you'll see patients that are very anxious. And once you get the translator in there to help explain what's going on, it's made a world of difference. So Anna Chisholm is the first translator that I met, and I interviewed her, and she was started out as an aide, was hired actually as an aide on the medical surgical floor at Broadlawns, and during her time there, they kept pulling her off the floor. We need you here. We need you there. Anna, you need to come over here because we can't understand what the patient is trying to tell us. And finally, she said to them, you're pulling me off the floor and they're getting mad at me because I can't do my patient care. And so somebody decided, well, maybe we need to hire her as a full-time translator. So she was the start. I believe it was in the mid-90s. Before we got our first full-time translator, and then many more followed after that. But she has a lot of stories about how different cultures approach health and illness. And she was telling me, she said, many times people don't go to the doctor unless they're feeling sick. And when we call people for a follow-up, they say, why should I go to the doctor now? Well, that's a good point. So I have to help them understand why it's important, because they feel okay after they've had their appointment and they get a shot of penicillin or some kind of a treatment, and they don't see the need to follow up. And she says it's hard sometimes. I have to tell people they have cancer or their baby is stillborn, and I cry with them. Okay, so I thought it would be interesting for you to see some of the aerial views of the property and how it's changed since the 1960s. You can see there at the top of the screen, that's the Des Moines River. And Broadlawns backs up to the Des Moines River. In the center of the picture there, you can see the tuberculosis hospital and you can see the cupola. This is in the 60s. And then you can see how that tuberculosis hospital is attached to the general hospital, which was built in the 1940s. And how you can kind of tell that it is was in the 60s. If you look clear down on the right-hand bottom of the screen there, those are residence housing that they built along Hickman Road. And the residents who came to Broadlawns in the family practice residency, they actually lived, still do, live on the campus. And so they built these ranch type housing for them to stay on campus. And then if they needed to be called into the hospital, they can just run across the road and be over at the hospital lickety-split. Here's an aerial view in the 80s. And as you can see, there's quite a bit of construction that has happened. And as you can see, when I talked before about the Broadlawns, well, those Broadlawns are pretty much gone now. On the left-hand side of your screen, there's a building that looks like it has 3 wings to it. That is the Sydney Sands unit. That is the mental health unit that was built right around 1980. It housed a large number of mental health patients at the time. And then on the right-hand part of the screen, in between the 2 parking lots is the Family Health Center, which that building housed a dentistry in the basement and then a family practice medical clinic on the top level there. And then here's another view in 2006, and you can see that they've added more construction between the Sydney Sands unit over on the left and the general hospital. They just kept adding on there. And if you stood out on Hickman and kind of looked forward at those buildings, you could kind of see the tuberculosis hospital peeking over the top. But by the time that I left the hospital trustee position, they built on top of that area, and you couldn't even see the cupola. So it's totally obscured. To the right of the Des Moines General Hospital, then they added on a major addition of an emergency department that happened in later years. Okay, the Family Birthing Center is another really major area that has shown a lot of growth and improvement over the years, and the number of births hovered around 300 for many years. But today, they are on track to have close to 1,000 births this year, and there were 3 major decisions that contributed to that. Nurse midwives were hired to practice within their full scope of practice. Additional female obstetricians came on board, and a beautiful new state-of-the-art birthing center made its debut. At the time that a lot of immigrants would not allow male OB physicians to take care of their females because it was a cultural issue with them. It caused a lot of problems. And so once there became female obstetricians, that solved a lot of the issues that came there. And then the midwives also. So I interviewed one of the nurse midwives, and she talked about why she stays at Broadlawns. She says the administration doesn't push her on productivity measures. They let her set her own schedule. Things come up during a visit you may not anticipate. For example, a woman may come in for her annual exam and she needs her IUD replaced. And in addition, she also has been feeling depressed. Rather than schedule another visit where she has to come back another day, you take care of that IUD procedure that day and you refer her to a therapist. This is a picture of the newest area that was completely remodeled into beautiful state-of-the-art rooms for women to labor and then give birth to their babies. I believe that Broadlawns is the only hospital in the state that has birthing tubs. They're not birthing tubs, they call them labor tubs. You don't actually give birth in the tub, but you can get into the tub and labor. And that's a unique feature. It's a quote, midwife reality, that those are in each of the rooms there. And then on the left, that contraption there is a baby assessment area. It's got everything that you would need once the baby's born to check that baby out and make sure the baby is functioning appropriately. Okay, over the years, there have been some celebrities, and some of you may know about some of these stories, but I'll just briefly kind of mention each one of them. Ozzy Osbourne was the recipient of the famous bat episode that happened in 1982. Ozzy gave a big show at Vets Auditorium, and as part of that show, he bit the head of a bat off. And that bat, they're not sure whether it was alive or dead, but it didn't matter. He had to have rabies shots. So the only hospital that had the serum for the gamma globulin was at Broadlawns. So Ozzy got the chance to come to Broadlawns and get a shot. And there was lots of questions about where he got the shot. Did it hurt? All of that. But I heard at a later time that Ozzy never paid his bill. So we'll see. I don't know if he ever did pay it, but at the time he never paid his bill. Another person that was there was Hillary Clinton. When she was running for president of the United States, she gave her healthcare proposal, her outline of her healthcare policy at Broadlawns. I got to meet her. She came there. It was very interesting. We converted the physical therapy department into an auditorium, and that's where she gave her speech. Robert Ray was instrumental in the refugee support of the Vietnamese, and he holds a lot of sway and influence into the community today. He served as one of the persons that headed up a report that looked at the future of Broadlawns. And then Joanne Zimmerman was the first lieutenant female governor of Iowa, and she was a School of Nursing graduate at Broadlawns. So I'll show you just a few of the buildings renovations that had happened over the years with Broadlawns. This is the new front of the building. They pulled out the front of the building and attached it to the emergency department there on the right-hand side. There's another angle of it. There's a third angle. On the left is the main hospital entrance. On the right's the emergency department entrance. This is the most recent building, freestanding building that went up. That building houses the dentistry, a beautiful new dentistry on the third floor. It houses a mental health clinic, and it houses the family practice residency clinic on the first floor. Went in and remodeled the med-surg units of the hospitals, which are beautiful views into the woods. You can kind of see that through the window there. This is a picture of the trauma room. The emergency department was completely remodeled and expanded so that patients had kind of state-of-the-art care in our emergency department. And then the dentistry is another very unique part of Broadlawns. It's pretty unique that a safety net hospital has access to dental care, and Broadlawns is a leader in this field. I interviewed the lead dentist who set everything up. And she had some stories to tell too about the patients she cared for. There was a dental laboratory where we sent impressions from which a bridge was made. It came back to BMC and the patient didn't like the shade of white. I called up the lab and was told that since my patient was on Title 19, they should be happy with anything that they got. I said, absolutely not. Mental health has also been a key service for Broadlawns, as the larger healthcare systems do not offer comprehensive community-based mental health services. Broadlawns cares about the patients and is the best medical facility to set the patient up to succeed when they're discharged. It takes a whole team of people who go above and beyond. The mental health unit, the inpatient units were also remodeled. This is a picture of a glass enclosed porch that patients can come sit and meditate or just be serene and look out on the woods. It's a beautiful, beautiful environment now. And here is the interior of the remodeled mental health area. And let me tell you, I was in the old unit and it was maybe akin to the cuckoo's nest in terms of how it was set up. Patients had to approach a glass cage where the staff was located and knock on the window to get their attention. It was not an ideal environment, but the present units are great. The most recent project is the Brain and Memory Center, which will offer the following services: geriatric, primary, and urgent care, a brain center, as well as caregiver resources and services. It will be Iowa's first comprehensive facility, which includes integrated treatment of Alzheimer's disease. I interviewed Dr. Shaw, who is a geriatrician, and there are people now coming to Broadlawns from all over for dementia care. The Memory Center, with its focus on the elderly, immigrant, and minority populations, is unique to Broadlawns. And then the last thing I wanted to talk briefly about before we get to the question and answer session is, you know, we are a community, we are a safety net hospital, and we're in contact with a lot of people in our community. And when they see the diversity and the care, it makes an impact on them. Broadlawns used to be one of the most despised hospitals. As kids, we used to cry when they told us they were taking us to Broadlawns. So now you see this maturation where Broadlawns is at the top of a lot of people's lists of where to go, and they have the resources people need here. It's one of the best community hospitals in the world. And that was from another person that I interviewed, who is the program coordinator of the Teach and Tech program, which takes students who may have lack of resources, and it allows them to take 6 college credits and get their certificate as a nursing assistant. And when they have those 6 credits, they can work at Broadlawns, they can make a living wage, and then they can go on as a stepping stone, either into nursing or medicine or wherever they want to be. So that's my presentation, and I'm open for questions.
Great. Thank you, Dr. Logan.
You're welcome.
And we do have some time to answer questions. As a reminder, if you do have a question, please submit it through the Q&A feature on Zoom. And please note, we might not have time to get to all the questions. We have a lot that are coming through now.
Okay.
So you mentioned, you know, Broadlawns is a respected hospital for the public, and we had a comment come through about Representative Neil Smith, who was Iowa's longest serving representative, served the Des Moines area, and had always said that if Broadlawns is good enough for the people, then that's where I will receive care. He passed in 2021. Did you get a chance to interview him?
I did not, and I wish I would have. At the time that I was on the board, he was not, I think he had retired. And so I didn't get a chance really to interview him, but I will say that I get all my care at Broadlawns and I get excellent care there. So he was right about that.
So you interviewed a lot of people.
Yes.
You spent a lot of time, you have a lot of sources. When did this project begin? When did you kind of think, I want to put together something?
Well, yeah, that's a good question because after I served on the board, I also, at the same time that I went off the board, I retired from my nursing program and I needed something to do. And so I wrote a few books, but then I thought, I don't think that anything has ever been written about Broadlawns. So I started digging, and indeed, nothing had ever been written up Broadlawns. And it just so happened that when I approached someone about writing the book, they said, well, gosh, not only is that a good idea, but it's the 100th anniversary of Broadlawns. And so I actually had a deadline. So I said, okay, I've got a year and a half to write this book, and I've got to get on it because it's going to take time to interview people. I knew I wanted to interview people because they give you the best stories. You can dig for pictures and stuff, but unless you hear their stories, I had an interview of April 2024, and I made it, I think, 2 weeks ahead of time. So I got it done then.
Impressive. Where did you go to dig up your sources? You had some great pictures. Where did those come from?
The hospital had some of those pictures. I took some of them when there was gaps. I had to kind of fill in the gaps and kind of make up my own pictures. But I had people that there were loose pictures around. There were some pictures, so I was able to dig through those. There was some. The nurses were the easiest ones because the nurses kept their annual. They had little booklets that they kept, and they also had brochures of their curriculum and that kind of thing. So that they were the easiest. Whereas because Broadlawns has in its history been a quote hospital for the uninsured and the underinsured, there was no one ever designated to keep the history. And so that's one of the reasons I felt it was so important to try to bring to life what Broadlawns really has been about, because there was nothing there. I mean, it was when I went into the librarian at the hospital, she said, well, here's some notebooks. And there was a lot of negative things from the Des Moines Register about Broadlawns. But then I was like, okay, well, yeah, Broadlawns has gone through some hard times, but what about all the wonderful things that they've done? So the oral histories really helped with all of that.
You did an impressive job bringing that to life. So we have some questions about some of those stories.
Okay.
One question is about the nurses who were serving the tuberculosis patients. How were they able to protect themselves while working with those patients?
Well, I believe they probably, being a teacher myself, being a nurse, I worked with beginning nursing students for quite a while, and they've had what they call protective clothing for a long time, and then I'm sure they put they had a mask on because it's spread by respiratory droplets. And so I'm sure that they had to they didn't talk to me about this, but it was probably the assumption that they put a gown on and a mask on before they ever entered the room to take care of the patients.
And you mentioned the pest house that was moved and attached to the back of the hospital.
Right.
It's still there.
It's still there.
So what is it being used for now?
Okay, it's been used for a variety of things over the years. It's been used for storage, but also the residents used to sleep in that area when they were on call for surgery or wherever they were taking call. The administration of the hospital has just recently moved there and then moved back out of there after they did some remodeling of the administrative areas. So it's been used for a variety of things. And when this as an aside, this was really interesting to me, when the new administrator came just recently in July, I took him on a tour. He asked me if he could go on a tour. His name's Proctor Lerman. He's great. Anyway, we came out back and I said, well, there's the pest house. He said, you're kidding me. He said, really? I said, yep. I said, at the time, Broadlawns was so poor that they needed to use every single building that they could use. And so they just brought it in and they attached it to the back, and it's still there to this day. So that was a funny story.
Yeah, still functioning.
Yep, still functioning.
Yeah. There's a question here in our Q&A. Did Broadlawns have a relationship with Still College of Osteopathy?
You know, we get a lot, well, Broadlands does get a lot of their students today from DMU, which is, I think, what still turned into Des Moines University, which is the osteopathic. But the hospital itself was Des Moines General, I believe, and that hospital closed. I don't remember when, but I would guess at the time that they probably did have a relationship, but I didn't dig anything up on that. So I'm not sure.
A question for you. We were talking before we all got started here. I said my mom was a nurse, and in the 70s, her guidance counselor said you can either become a teacher, a secretary, or a nurse.
Right.
So what is it that inspired you to get into the nursing career?
Well, interesting. I had a great grandmother who was a nurse, and she didn't become a nurse till she was 46, I believe was her age at the time. She was divorced, and it was kind of scandalous. And I loved my grandmother. She was just a wonderful person. And then I had a 4-H leader who was also a nurse. And so again, it was 1971 when I graduated from high school. So that was just the path that I took, and I was never sad that I took that path. So it was good.
Great. And this will be our last question here.
Okay.
To get ready to wrap. Could you share a little bit with our audience about, first, where they could go to get your book? And second, do you have any events coming up that they could attend?
Well, good question. Right now, my books are for sale at Beaverdale Books. They are for sale at the Broadlawns gift shop. And I also have books available, and my email address is Jean Logan, all one word, at mchsi.com. You can contact me via email, and I would be glad to send you a book if you want to pay the postage for it. So.
And we'll have links when we send this out where they can go to buy the book. And hopefully they'll be able to see you around town.
Okay, great.
And get some access to that. So with that answer, we're going to bring our webinar to a close. Thank you to everyone joining us today. We'd like to extend one last thank you to our presenter, Dr. Jean Logan. And we hope that everyone will sign up for the Iowa History 101 webinars that take place on the 2nd and 4th Thursdays throughout the year. There are many great stories to tell in the upcoming months. For more information and to register for future webinars in this series or to watch our recordings, check out our website at history.iowa.gov. Looking to learn more Iowa history? You can find and watch over 90 recorded webinars of past 101 programs on the Iowa Culture YouTube channel. We look forward to virtually seeing you for the next Iowa History 101 webinar on October 24th. The topic will be Red Earth Nation, a history of the Meskwaki settlement. Thank you all again for joining us today, and have a great afternoon.